Coach Tess, and today we are going to focus on anesthesia for the CPC board examination. So, what I normally tell my students is you need to become very familiar with some of the terms per section in the CPT code manual. Okay, so let's jump right into it. So I normally do it this way, especially like keywords, that this book right here is one of the AAPC manual. This is where they use it to study for the CPT port exam. Some people use the CPC study guide, and a lot of these terms are at the back of the AAPC study guide, and it's in the glossary section. But this one, they basically, see the term glossary here, they basically break it down per section. But if you use the study guide, it's at the back, okay? And it's in alphabetical order. So let's go right here. Add-ons. So add-ons is a term that is used in the CPT manual. It's a code, it's a plus sign beside to the left of the code, and with that you only have to use it with another code. So that's very important. All right, so you have the anesthesiologist assistant, anesthesiologist, anesthesia time. So it's good that you learn right here anesthesia time, and this is where when the anesthesia, before they start applying the anesthesia, how long does it take, how long does the patient stay on the anesthesia, and when they get out of anesthesia. So with that, you have to learn how to calculate your anesthesia time. Okay, that's very important for this section. All right, the arterial line, you need to know if it is included or not included in your anesthesia code. Okay, let's move on. You have the baseline value. This also, right here, this also helps you with calculating your anesthesia time. When we start doing those videos for anesthesia calculation and those stuff like that, you will see. Okay, you have the cardiopulmonary bypass. Remember, anesthesia covers all of the sections, right? All of the body sections, all of the section from integumentary all the way down to nerve, eye, and ear. So you'll see that it covers cardiovascular, and there's a section in the anesthesia that covers that as well. Central venous catheter, is it included? It's not included when you're basically coding anesthesia. So that's where that comes in. All right, let's move on to the conversion factor, right? The conversion factor, that is also included in the calculation of the anesthesia time. Sinus, central venous pressure, emergency, that is also in your guidelines of in your anesthesia, the front of it, you'll see that as well. Flat fee, general anesthesia, a drug-induced loss of consciousness during which patients can't be aroused. All right, medical direction. Now this has to do with your modifier, AAPC modifier. When the doctor or the anesthesia writes their report, they will tell you, who they assisted, what direction did they do, who did they direct, all right, so that has to do with your anesthesia modifier. Medical supervision is the same thing. Monitored anesthesia care, all of these right here, see, medical direction, medical supervision, monitored anesthesia care, those has to do with your anesthesia modifiers. So pay attention to those. The PAC, pulmonary artery, and catheter, sans one's catheter. Is it coded separately, or is it coded with another procedure? So these are some of the things that you need to know, okay? All right. Physical status modifiers. Your pump originator, qualifying circumstances. These are a part of the term qualifying circumstances. These are a part of your modifiers for your anesthesia. So that's very important. So this video is just to give you an highlight of some of the things to come, or what you're actually studying in the area of anesthesia, or what possibly might come on the exam. Regional anesthesia, relative value of a unit, and this is when you're actually calculating, for billing in this whole arena of medical billing and coding. Our resident anesthesia, student registered nurse anesthesiologist. So just like that, you have CRNA. So you have the student one, but you also have the certified registered nurse anesthetist. Surgical feed avoidance, total body hypothermia. So then, in your guidelines, they might talk about hypothermia or hypothermia. Okay, hypotension versus hypertension. My apologies. And please subscribe to our videos and let us know if you have any question. Visit our website, HealthEversity.com. Anyway, talk to you later.